Hi everyone, sorry there's been a pause on the videos, but I had a little technical difficulty. I need to have a better disclaimer on the video, so I'm going to read to you what that disclaimer is until we can figure out the technology to insert that into the videos. So I think you know this, but this video is solely for educational purposes and should not be construed as patient advice. The opinions expressed are my own and do not represent the views, opinions, or holdings of my employer, whether past, present, or future, or anyone else. For medical advice, please contact your child's physician. So today's video is about potty training, and this is one of the ones that was specifically requested. These are just a few tips. Of course, there are so many things we could talk about surrounding potty training, so these are just going to be a few quick tips for you that I hope you find helpful. First of all, I have always found that it helps for children to potty train when they have better use of just a few simple words. So if your child is not to the point of being able to even say pee-pee or poop or potty or mommy or tummy or help, it might be harder. And I have found personally a correlation with toddlers with expressive language delay and often a harder time potty training. So you may have noticed that as well in your experience. So when you're trying to assess for readiness in your toddler for potty training, they should be able to walk to the potty. They should be able to pull their pants or pull-ups down so they can sit on the potty, and they should be able to use some basic words just to let you know what's going on. So when you're trying to decide whether you should tackle this potty training challenge, just look for those signs of readiness. And also, just practically speaking, summertime is great because then they can be halfway naked already because it's warm enough. They could just have on their pull-ups and make it quick and easy to try to go to the potty. Now, these really are just my opinions, and everybody feels differently, and everybody's child is different as far as their maturity level and willingness to learn and excitement about potty training. But I have always recommended that you actually get the small potty chair that sits on the floor. I have seen so many children that got scared by the real toilet that flushes and makes a lot of noise and has the water. They may feel unsteady. They really do need, especially when they learn to poop on the potty, they need a place that they can hold firmly and they can plant their feet to feel secure. And so this seems to be easier on the small potty chair. So what I recommend when you're very first getting started is just talk it up. There are books from all sorts of different little characters about potty training. There are videos on potty training with children's characters in them. You can get the little potty even as early as 18 months and just have it around so they feel comfortable with it and they can make it their own. They could color on it. They could put stickers on it. I've had mixed reviews of the ones that make noise when they pee-pee or poop in the potty. I have had patients who actually got scared by that sound, so that might not be right for every child. So I do recommend you get the little potty instead of starting on the big potty. Most children train for urine well before stool, so really focus your efforts on pee-pee first. Most little boys, I found it easier to train them sitting and tucking instead of standing, just for logistical reasons. A lot of times it works out better that way. The stereotype has always been that girls train easier than boys, and that is often true, but it's not true in every single case. So again, it's very much an individual basis on your individual child and the mood they're in. And you may discover, if you're dealing with 2-year-olds, that some days are better than others, and it does simply depend on their mood. So if your child is getting frustrated about potty training, is getting angry, it is all right to just back off for a few minutes or a few days or a few weeks and then revisit it later. Because if they're starting to resist you and you're engaging in a power struggle over going pee-pee on the potty, you're mostly going to lose. So we start out keeping this all very, very positive. Praise your child for every individual thing they do. They use the word pee-pee, or they walk towards the potty. They pull their pull-up down. Any little part of this, they wash their hands afterwards. You just praise and praise and praise. Now, opinions vary on food rewards. The general advice is not to use food as a reward, but I know so many times when just one little M&M or some tiny, tiny little food reward can make a huge difference and really seem to motivate the children pretty well. So you may want to try that. That's, again, up to you and your family choices. I do think that it's important to only have one major stressor in your child's life at a time. So let's say you're expecting another baby. Maybe this isn't the time to tackle potty training, or you may be trying to transition from the crib to the toddler bed, maybe the wrong time, or your whole family's moving to a new home, maybe the wrong time, or you're trying to take away the pacifier, maybe the wrong time. So of stressors that could be in a toddler's life, try to pick one at a time and not do all these different changes all at the same time, because that could just stress them out too much and we don't want to do that. Now, Some people don't even agree with using a pull-up. They just want to use big girl panties or big boy underwear. But I think pull-ups are fine because they really reduce the amount of work you have to do, and I'm okay with that. We talked about it is okay to take a break. And the other thing to warn you about is that a lot of toddlers can develop constipation in the potty training times. So just be careful. If they're getting hard stools, it's okay to use Miralax. It's okay to use a little fruit juice or chop up prunes into raisin-sized pieces, increase their fiber, increase their fluids. But make sure they're pooping even if it's in their pull-up and not in the potty. That's okay temporarily so that they don't get too constipated. I hope these tips have been helpful. Thank you.